What's up, ladies and gents? Welcome to another nurse meme review here with your boys, Peter and Matt. We're about to review Haldol Daddy. See what you got for us, man.
Yeah, let's see what he's got. Last time we did cold blue. Didn't do too hot. Maybe it was a rough week, but we'll let him slide. Got the buzzers back.
Let's roll.
Good time.
Going with MRI to a patient got me like...
And it's just man from Afghanistan just chilling. Yeah, MRIs always take a minute. You're always there, especially if it's with contrast or anything like that. You're always chilling there.
40 minutes.
Yeah.
I'm glad we're in Cali so a nurse could watch her patients.
Honestly, it's clutch when you got to go MRI last of the shift and you're off the next day, because then you're just chilling down at MRI for like an extra hour. You get paid overtime rate. And you're just cooling it.
That one was okay. I should have hit the buzzer on it. Okay, let's go next
I thought it was pretty funny.
Okay.
Screaming internally or silently in the mask is like 85% of nursing. And then we got Michael Scott from The Office. I can relate to blenders because I also scream while I'm doing my job.
Sorry, bro.
I guess it's not our kind of humor, you know?
Yeah, not our humor. Let's go next one. Cursed Easter egg hunt. And it's a video, and we're looking for the Easter egg, ladies and gents. I don't know where it is. Looks like it might be in the large bowel up there.
What's about to happen? You guys are not that good at reading X-rays,
digital disimpaction order. Oh, he's just full of stool,
yeah,
bro.
I can see it now.
The Easter, it's not literally an Easter egg. It's just the amount of stool that there's in there, bro.
Surprise.
Surprise. That's a lot of poop, man. It was funny, but we didn't catch it. Yeah.
You want to race? You do the countdown.
3, 2, 1.
Damn.
Pretty quick.
Quicker in your own game, bro.
Let's go next one. For any person to be a hospital executive, they should have to take and pass a certification exam, and of course, they'd be awarded a credential to place behind their name. Karen Smith, certified HOE.
HOE. Yeah, I'll pass this one too. One of them says new grad RNs, and it's a young black guy, and next to him it says same RNs after 1 year nursing. It's an older version of him.
Also, if you work night shift, bonus points to getting older quicker might take you like 8 months or 6 months.
Yeah, it's like, you know, when you watch Presidency and you have the president, like Barack Obama is a good example, or even a Bush. You see them before they enter the White House, and then 4 years later, they look so much older, man. That stress is just added on. That's how nurses are too, man.
Yep.
We're the presidents of the hospital.
5 years and it's time to retire. So healthcare workers and hospitals, indeed, I need for you to provide better work conditions with proper work equipment, proper staffing, and at least 40% pay raise. You know, he's like whispering it. That's funny. We need all those, please.
Facts. Not that funny, but
it's facts.
It stands for the right thing. Yeah. Next one we have Peter Griffin smoking a cigarette. The freaking fly enjoying a smoke before coming into the ED to put on the performance of a lifetime. Dude.
Do you remember that black guy you had in Oakland that was in a purple suit?
Yeah, dude. He signed himself out AMA. Man.
And he came back for his money.
Yeah, he came back for his money. This guy was so upset about our care. He signed himself out AMA. And it's the funniest thing in the world, because all he wanted was to just hang out for the night and eat. And he signed himself out AMA. And the funny thing about it is he literally walked out with a purple suit and he forgot his check in security.
I'm pretty sure that's the same guy that faked his stroke and got some TPA.
That's the same guy. Yeah, it's the same dude. So the whole thing, he faked his stroke. And then that's it. He was a reverend from a different state too. So that's why. It's crazy interesting, yeah. That was a whole different trip.
I'm glad they're not giving Dilaudid in the ERs anymore.
No, man. Are they not?
No.
Really? Is that recently?
Chicago signed the thing.
Damn, just Chicago, huh?
Well, I don't know. You'd have to look it up.
Damn, that's some shit. It's a trip.
Nobody. HCA recruiter when some actually responds to the email. I don't know. I never thought I would get this far.
It's plankton, because he's always scheming up something.
Yep. He's always trying to freaking finagle us for those lower rates. Not that funny. Sorry, bro.
Next, we have Joe Rogan in a sauna, super sweaty and red. Patient's anal sphincter looking at me. You getting that rectal tube ready with no lube. Dude, for real, man.
It's funny. Imagine there's like some hemorrhoids popping out on the side.
Some veins or something.
It's the worst, man.
It's a shame. You always got to lube up the Flexiseal rectal tube. You have to, out of respect, you know?
Yeah.
Nobody else wants someone else's fingers in your butt, you know?
It's all in good faith to prevent skin breakdown. All right. My brain telling me to dissociate while doing chest compressions on the 100th person this past year. Do it.
Yeah, man. For real.
Poor baby nurses, man. PTSD.
Yeah, especially when you have that week where it's just super sad.
Yeah.
Not to bring sadness onto this meme review, but man, sometimes you gotta
pump the chest when you're doing the code.
Yeah, it's some shit. He's leaning on his arm. Watching the charge RN stress out trying to make assignments when we're down 5 RNs and 2 PCAs instead of calling Safe Harbor. They're just going to wing it.
Safe Harbor.
Just gotta wing it.
If you swipe to the right, watch my manager tell me that I could have done more during my annual review.
For sure, dude.
Yeah.
Right? They always pull that stuff, man. They always have like what you can improve on. What do you mean? What can I improve on? Dude, I've been working short staff for like the last year. Tell me I gotta improve on shit? I can't improve on anything. You don't provide the basics of what I need.
Yeah, man. This is
a guy in a red suit. Some fireworks where your patient sees after you've given them Dilaudid. Is that how it feels? I got Dilaudid one time.
When you have a narco, it feels like you're in a blanket, like this warm feeling. You're by a campfire, so you get that head rush like heroin, supposedly. This one guy told me.
Yeah, that's how it becomes addicted. One guy told you, huh? So he's had it a few times.
Yeah, you got
that's his first chance of the drug.
Pushed it really quick.
Yeah.
POV, your shift has gone to complete crap, and you're giving up on fixing time.
Like Kim Kardashian, right?
Yeah.
Like Kim Kardashian? Yeah, for sure. It's like, I give a fuck. It's got a skeleton and a hat, like a sombrero. Me catches up on everything and finally sits down to chart. The air bubble at my patient's IV pump. Buenos dias, fuckboy.
Yeah, that is the worst feeling. And we got these new pumps in the ICU where this thing is so sensitive. Any single time you can't back prime it, and sometimes you got to prime flush 2 mLs. Pain in the ass on those new. I don't know what the company's.
Are they technically new? It's just a different brand.
Different brand, but new pumps.
Not Polaris, something else. Super annoying.
Something you don't want to get in your hospital. Stick to the Laris and Hospira, whatever it's called. Patient before surgery. The patient after 1 week in the ICU. Yeah, that's funny, dude. Dude, that patient's family comes in, they're like, WTF is happening? He was just walking fine a week ago.
Yeah, that's a week ago. Yeah, but for sure, that's crazy how a patient transitions like that. It happens to their teeth. Damn, that's a trip.
Lose their weight.
It's a trip. When you get written up for having a little razzle dazzle, Bailey's Irish cream in your morning coffee. Everybody's both a bit sensitive these days. I'm not
Wanted the buzzer.
Yeah. Want to race again?
No, I just hit it.
Because knew I'd win, anyways.
Nursing, trying to understand how we went from heroes to zeros. Taylor Swift, I know how you feel, girl, man. Shit sucks. We went from having food catered to us, people donating to the hospitals, to improve on your annual review. Yeah. Things suck, and things always been sucking. Give us the damn resources.
Yeah. Or put a ceiling on how much you can make, a cap on how much travel nurses you can make. Like, I have never heard about that in my life with any profession where you could limit the amount of money someone can make.
They're always coming after the little guy. What about your salaries?
Business. What about your salaries, huh? NCLEX math problems no one prepared you for. If you have 39 LTAC patients and on average have to pass 5 meds to each one and do 15-minute full body assessments and chart them, how long will it take you to get out of prison if one of them falls and dies? Damn, for real, bro.
That is the truth, that knows how to juggle this stuff, and it creates freaking stress.
Yeah, isn't that crazy? They have all these rulings and laws that say, hey, if this happens, this is what the repercussions are, but they don't take the outside picture. They don't take a full picture into perspective because they don't know what the hell is going on. They just know this happened. Damn, that's a trip. When the physician does a bedside procedure and leaves it all dirty. Yeah, you want to get the scalpel and get him.
Jesus, this sounds like murder out here. And that's what it is. They just, you know, they're cutting the skin to introduce a freaking transducer to make a freaking room for it, and freaking 12 French, 18 French. Like, damn.
Yeah, dude. There's been some bloody situation if someone's putting an intro in and they're trying to. You can feed the intro, but you can't feed the line through it. There's blood everywhere, especially if it's like an IJ.
Or chest tube cuts. Yikes.
Yeah, that's super annoying. Yeah, clean up after yourself, doctors.
This made me cringe.
Yeah, I know you can leave some stuff, unattended too, but just clean up your shit. Use some of it.
Go into healthcare and people will respect you and the work you do. So it was a fucking lie. Tyler, the creator, bro. It's exactly what happened. Hospitality service fucking us up.
Dude, if you have never experienced somebody looking at you and you tell them not to piss on the ground and they piss on the ground anyways, that's the amount of disrespect we get as nurses sometimes. That's disrespect, because not a lot of people have experienced that in life. That shit we gotta deal with sometimes.
We deal with the worst of the worst.
Yeah,
it's humbling, and that's when you walk out like, bro, you lied to us,
dude. Yeah, imagine you look at a guy right into the eyes and you tell him don't piss on the ground, use the urinal, and to spite you they look you back in the eyes and just piss on the ground. That's wild. It's a trip. Next one here, nursing grad school interview. Why do you want to be a CRNA, NP, PhD? What do you say? I like to acquire specialized skills and knowledge to advance my practice. What you really meant to say? My body can't take no more of this effing bedside bullshit.
Yeah, it's that time of the year again. got busy a couple years ago. It's time to move up and get rid of bedside. I feel you on that one, boys and girls, and the nurses out there.
That's the truth, because there's definitely a point in a nurse's career where it's like, take me anywhere except for bedside. Give me anything. I'll go back to school. I'll do papers. Anything but bedside. I think we're at that point too in our lives, to be honest.
I see your pizza and I raise you rubbers and tea bags. It says a penny, so you'll never be broke. A rubber band to stretch beyond your limits. Snickers to be the laughter in your bedside medicine. String to hold things together when everything falls apart. That is the kit, man.
That is more for the patients than anything. I'll use that as like a bribe to the patients. Be like, hey, want something sweet? Hospital food sucks. I got Snickers. Do this though. Take your medication.
You know, this reminds me of when I'm packing for like my PICC line draws at 4 a.m. and I'm putting saline flushes and tubing in there, and this is like a pack that they just pack for nurses so they could survive. Here you go. Feed yourself your dopamine.
All right, next we have little Yoda. Slipping your needy patient the Ativan PRN with the rest of their meds for your own sanity. Oops, that was legal, but it's fine. Damn.
Sometimes you gotta do what you gotta do.
Because technically, if they're confused, you gotta make sure they're okay. You gotta give them a little Ativan.
It's just a multivitamin.
Yeah. It just tastes the same to crushed up in applesauce.
Next one. Say, damn, that's crazy. Good luck, though. But in doctor, thank you for the interesting consult and do nothing.
Yeah, man.
Cha-ching. Collect that bag when you consult. Yeah, some of these docs when they're around, that's exactly what happens. Or the worst things when you're working night shift and they put a note on nights and you didn't see anybody in those hallways. No doc came by. Just collecting the late night check.
Yeah, I had a patient with potassium of 2.8 and told me, okay, thank you. Pharmacy will address labs in the morning. I was like, okay.
Let me ask again. Potassium is 2.8.
No, I didn't ask again. I was like, hey, he should know better. Not the news doctor. We got a cat. When a medical team does nothing for a patient, but drops notes saying, thank you for the interesting consult.
Okay, so that's it's a repeat one.
Yeah.
You can't repeat your memes, bro.
You got a kid with curly orange hair. We really need help today. Triple bonus if you come in. You think about it, like, nope.
Yeah, you're like, damn, I just finished 3 out of 3. Maybe I'll come in, maybe not. Yikes, bro.
It gotta happen. It's always worse.
Sometimes you have a glass of wine already. You're like, nope, can't do it.
Why should we hire you and just a person with a blank stare? You got any other choices? How are you gonna fill your staff? You got me. That's it.
What are you gonna do?
Not hire me?
Yeah, you look like you're freaking short staffed. 4 nurses every single shift, pulling people, no breaker, no breakers. What you gonna do?
It's that point where you gotta convince the future employee to come to your hospital.
Yeah, you're doing the interview process. How's your work culture? Is it toxic?
This was actually pretty funny. It says, it's a patient's chart with a bunch of random allergies. It says, I want to play a game. And it's that guy from, what's that movie called? The scary movie.
The Saw. And it says all these allergies listing out. Losartan, ragweed, high, cabbage, cat hair, clonazepam, dog dandrum, grass paws, hydrocodone, molloxicodone. Unable to assess. Epic allergy text anime. ARM. ARM.
What? Yeah, what is that?
What is going on?
There's one allergy that's unable to be assessed, but it calls epic allergy. ARM.
What does that mean? Some nurse got tired as hell. You put in a random allergy and left it.
That's actually funny. Alright, cool. Alright, guys. Thank you for your time. Thank you for joining us on another meme review. See you guys next time.
Peace.